You're listening to the Patient Advocacy Now podcast, presented by Greater National Advocates.
It's just gut-wrenching sometimes. Like, if it's sad and they're crying, I might cry.
Amazing how many doctors do not even want to treat somebody who has Medicaid.
Medical system is about making money.
And I said, so are you hiring more nurses, or you're just telling each nurse to work harder?
Tina is a board-certified physician associate with 10 years in vascular surgery, acute care medicine, and wound care experience. She's the founder and CEO of the 501c3 nonprofit, Less Leg, More Heart. They provide support, supplies, and services to United States amputees. She's a New Hampshire native, a toddler mother, public speaker, adaptive athlete, and passionate disability advocate. Tina Hurley, welcome to the Patient Advocacy Now podcast. Thank you so much for being here.
Thanks so much, John, for having me. I'm excited to connect, and I'm just such a fan of GNA, and it's such a pleasure to have these conversations and hopefully have some folks in the community learn, vital information and some resources that'll help them out.
Yeah, we're excited to have you. We haven't had an amputee kind of focused advocate or someone in that space yet, and I'm curious to hear your story, how you got started, and what drew you to that cause.
Yeah, it's, folks joke that it's divinely intervened on or universally nudged, but my circumstances, I sort of saw things from the bedside as a clinician and also from the bed itself as a patient at the same chapter in my life. So one of these things is a physician associate degree, and I worked in a practice where I amputated legs for a living, and I rounded on all of the patients and took care of all of the adverse outcomes and watched them struggle with the barriers that they had to navigating the system, understanding the system, and the other barriers that made their ability to comply with the medical plan unsuccessful. And as a clinician, your hands are bound by FDA regulations, which govern the things you can provide, needles, narcotics, surgeries, and some other things sprinkled in. But it wasn't often the most successful, and people needed more education and more, just navigation and more, social work to fill the holes in care to really fix the problems that were occurring. In medicine, we measure secondary outcomes like infection and depression and suicidality and opioid overuse and readmission and et cetera. But we oftentimes don't have the capacity, time, or affordability in the system to really govern and fix the problems that lead to those outcomes. And it's a systems issue. It's not anyone's fault, but because of the way that insurance is and the governance that it has over the direction of care for patients, the clinicians are sort of stuck, in the middle of this tier that makes everybody in it struggle at times. And so when I became an amputee 7 years ago, I then felt what it was like on the other side of the bed to suffer the outcomes that resulted from poor communication between providers, lack of understanding of my insurance, medication that rendered me unable to execute or follow up or, just direct my care in the most logical way, because I'm also processing a significant amount of grief and trying to go through stages of grieving while I'm in incredible pain and medicated and doing everything as a new skill as a new amputee. It's so overwhelming. It's like you just got dumped off of a tidal wave and you're kicking ferociously, trying to swim, and you don't know which way's up. And so anyway, I realized that despite still being board certified as a PA, I just wanted to take a stab at creating something that could fill in some of those holes for this specific demographic, amputees, and get that going, and then return back to practice knowing that the amputees that I'm creating by my hand are also ones that won't suffer from the same, lacking collaboration and knowledge and care. And so that's sort of what bred Less Leg, More Heart 5 years ago.
And have you returned to being a PA and working in that capacity as well?
No, I've still maintained all of my accreditations, and my son is 2.5 years old, and So,
Okay. Enough said, right?
running the household and growing this human and running this business is definitely hands full. But my dream is that, when he gets into preschool or first grade, that things are operational enough and large enough from a funding source. Our internal operations are really well greased. It's just a matter of, as an organization, really solidifying the financial landscape of the nonprofit and, making sure that you can hire employees and, solidify a few years of salary for them so that I can hand it over. Because I'm a great medical professional, but here I am, a business person. And even though I'm doing pretty good at it, there are probably better suited folks to step into those executive roles to help guide the business side of the organization while the beneficiary side is handled by us clinicians.
Yeah, absolutely. And I mean, look, it's such a fascinating story. I mean, you're sitting there amputating limbs, and then you wake up one day and find out that you're going to be on the table. How did that happen? What exactly led to, and was it a total shock? Was it something you knew that was coming?
Yeah. So the timeline was, I felt fine until I was about 25, and I had graduated from schools, and I was doing CrossFit, and I had always been an athlete, and my legs just started to feel heavy. And they got more and more debilitating in terms of their capacity over the following few years. And, I went through all the specialists and all the tests, exhaustively, misdiagnosed, and then just in and out of the washing machine of diagnostics to get a diagnosis that eventually was made. And concomitantly, I was working in acute care medicine as a hospitalist for a large trauma center. And I realized that I didn't know as much as I should know about the diagnosis and the topic of vascular. And knowing that I was going to be in that field as a patient for the rest of my life, and that my mother also is a vascular patient, I just felt a calling to transition over and learn more and help people in that field. So I got my diagnosis before I transitioned into vascular surgery, but before I also knew that I was going to lose my limb. And then 13 surgeries later and 3, amputation revisions later, I got out of the practice to run the nonprofit. But the process of, taking limbs off for a living was not part of what I thought going into vascular surgery would be. I thought it was largely a clinic job, and I loved surgery. But when I found out that after the 10 surgeries had failed, all the debulkings and the vascular bypasses, and that for me, the best solution was going to be losing my limb to regain quality of life. So essentially, it was a semi-elective amputation. My options were to live on chronic narcotics and be unable to really do my job or live life at all at this time in my early 30s, or lose my limb. It's a no-brainer in terms of which direction you need to go. But knowing what I saw on the medical side was scary, because the folks that I was largely turning into amputees were, chronically comorbid, vascular, aging diabetics. And I didn't identify at all with that demographic. And I didn't know anybody else in the amputee space. And so for 6 months, I was trying to find the right surgeon to do an erdal amputation, which is a specialized kind that was, strategized to be more successful for my circumstance. And I was working Monday through Friday, still in the OR, and had to really dissociate from my identity and my future and my struggling and my suffering, because in order to execute my profession and really empathetically care for people and make the money that I needed to pay the upcoming medical bills, I had to not acknowledge that that was my fate in a very, very short period of time. And that was tough, because I also became very far from my center. And I was at that time newly married. And we didn't know at the time we were married that I'd be losing my leg or that my graft would fail. We had hope still. We were told we were going to get fixed. And so while I'm lining up waiting for the surgery, I'm medicated outside of my shifts. I'm in pain all day, every day. My interactions with my husband are limited and very much focused on my needs, because there were so many at the time that it deprived me of my life and my hope and my joy and my happiness. And I had to go numb because feeling was too overwhelming. And in retrospect, I didn't get the help that I likely needed during that time. Psychotherapy wise, I absolutely had clinical depression and anxiety and probably even panic syndromes, and was self-medicating sometimes with wine. If I had to do an amputation that day, I'd come home and it was so much, I couldn't ignore the fear. And I would find myself at the bottom of a bottle of wine that evening, which for me is a lot. And I'd feel, bad the next day. And it was this cycle of just terror. And there wasn't really hope at the end of the tunnel except for losing my foot. So I did what I felt was right, which is like prepare the best I could. I took my foot for a lot of last ventures. I zip lined with my shoe off, and I, crushed 20 pounds of grapes in a bucket, and I got a henna tattoo because I didn't have any other tattoos at the time. And I, felt beach sand and walked on grass. And like, I just did everything that I could do to feel at peace with the decision. And I faked a lot of that to everybody around me because I didn't want the people that loved me and cared about me or my coworkers to give me pity, treat me broken, or worse, be scared themselves. And so the stronger that I felt like I was showing them I was, the less suffering they went through. And that imposter situation really depleted me. It's really tiring in an already exhausted person to be so fake. And the only person that got the real terrorized person was my husband. And I lost my leg, and I remember waking up with the sheet flat where my foot had used to be. And despite all of the preparation and knowing for 6 months, it was really tough. And I'd always identified by my physicality and who am I now, and how am I going to do these things? And I suffered a lot of like secondary issues in the hospital. I had these neurogenic cramps that were absolutely horrific, and they had me on just really strong cocktails of medications. And, an overnight hospitalization was 10 days long. And when you're on these heavy duty medications, at one point they had me on a ketamine drip to mitigate some things and reset my pain signals. And it causes psychosis in people, like medication induced delirium, which is transient and common. And my husband didn't know that. He goes through these hardships for 3 years, and then this person is, almost like an Alzheimer's patient that is not mentating. It's like you just lose reality for a short period of time until the medication's tapered off. And thankfully, when it tapered off, you resume your normal cognition. And I had fallen in the hospital. I had this huge wound. It required 8 months of debridement and wound management. It was like I had to have a revision surgically. And then I came home on the 1 year anniversary of or the day after the 1 year anniversary of my leg amputation. And just all of that, just chaos, resulted in my husband unknowingly like distancing himself emotionally and not knowing what else to do but leave, because he was so unhappy. And why wouldn't he be? He went from gas mask jump roping in a CrossFit gym with this woman to a couple of years later dealing with someone that wasn't even mentating normally in the hospital. And it's like, it's just everybody had such a hard time. And I found myself in the wake of those losses, the loss of my foot, the loss of my marriage, and then, resultingly having to sell my home and rehome my dogs, and really starting from scratch in my life, having to figure out what my purpose was and why this is all happening and what I can make with it and who I am now. And that rebirth, in a sense, was where all the beauty sort of came in. And when I realized things might be happening for me and changing my perspective and practicing gratitude and realizing that community and connection and advocacy is such a vital part of success in life, and that I'd been missing the mark my whole life. I was so obsessed with success because I came from a very, blue collar, struggling to get by family, and didn't want to have the same challenges. And I managed to accomplish that, but that is all removable. And what I had neglected to do the entire time I was expending energy outward to climb the ladder to be more successful and stable was I actually never really spent time to build like a home inside of myself and figure out who I was and take a pause intentionally to heal from some of the prior traumas in my life until when you're completely stagnant postoperatively, it catches you. And that was some hard work. that that was a few years of just real hard intentional work, and it spit me out in a beautiful place. And I think service and advocacy were the things that really saved me.
What was your, real big realization right away, being a patient versus being on the other side of the surgical table, where you're like, oh, this is missing from what we were doing for people? What was the first thing that kind of hit you?
There were two things in the same 24-hour time frame. I was in the hospital after one of the revision surgeries, and one of the medical folks for the clinical team had come in. Nobody had talked to me about the intricacies of the procedure or gone over any of the risks of the procedure, the consent form classically. And anesthesia came in and bolused me with the medication to get me into the OR, which makes you sedated and starts to impair your ability to think and have memory. And I was asked to sign a consent form after I was given those medications. And only after I woke up and had healed many days later, did I, after I requested my medical records, because I always do that and it's very, very good practice to do, I realized I never remembered signing that form. And that's horrifying. And on the same 24-hour schedule, the next morning, I had a drain in place for some of the bleeding postoperatively. The next morning, I had a medical resident come into my room and not wake me up. I was still sleeping when they ripped the drain out of my leg.
Wow.
Yeah, because it wasn't supposed to hurt. That was when I started to become the difficult patient. The one that specifies you're going to wake me up 30 minutes before I see anybody and have to think, and you're going to, X, Y, Z. And then realizing after becoming that difficult patient that it creates, in a sense, a barrier to your own care. And then that's hard to navigate when you're in the bed and you're vulnerable and you're medicated. And, those were really the standout moments. But you won't have enough time for me to explain all of the personal and also the folks that I've cared for now, hundreds of amputees over the last 5 years, just the horror stories that trying to move too quickly with maybe not as much bedside training is needed. And also not the personal experience that a lot of clinicians would benefit from having in treating people. I think the best education I ever received in 8 years of college and a medical degree was being a patient, because until you understand the effect of your verbal and nonverbal communication on a person's life and spirit and energy and vigor and family life, until you experience that, you don't have the same caution every patient every day. And I can understand that side of it. You open up 15 to 30 doors a day to find a new person, and you objectify because that's what helps you cope with the things that you're managing, which are traumatic every day. But inherently, that pace and that objectification leads to sort of a slippery slope, and a lot of folks fall into it.
What do you find is the most common thing that the amputees who come into your fold need help with?
Understanding and connecting, understanding, connecting, and funding is the most common sort of triad. They don't even know what to ask sometimes. We'll get our workflow management software and our sort of system is folks will submit their information on our contact page on our website, and it goes into, our workflow management system, and our beneficiary team takes over, and there's a little comment section, and it says how can we help you? And we're very clear about the pillars of our assistance, which is mentorship, advocacy, funding for holistic care, which is intentionally vague, and funding for home services. And I can tell you, and statistics a little rough here, but at least a quarter of those people, as an average, write something to the effect of, I'm not even sure what I need. I just need to know what I need and how to do this, and where to go and how this works. Because understanding living with a limb loss physically and emotionally, in addition to the complex insurance and medical landscape, is profound to have to digest, study, and become a master of while you're actively just becoming a new patient in it. And so I think that's the biggest thing, is they just want to figure out what they need to know and how to get through it physically, emotionally, and financially.
Did you find, you mentioned psychotherapy as something that you perhaps should have gone into when you got your diagnosis? I'm curious, is there a type of therapy or a type, I mean, obviously the support group must be incredibly helpful because you're kind of identifying and connecting with peers, but is there a type of therapy that you have found that is more successful or more impactful for people who have become amputees?
Yeah, the significant piece that we see in terms of like DSM criteria diagnoses are depression, anxiety, and PTSD. Those are like the three most common things that the folks that come to us report as diagnoses. And the depression and anxiety we see because we have a very sophisticated intake where we know everybody's socioeconomic situations and their psychosocial situations and all of their medications. And like, we really are thorough with the information that we harvest, because we have to have that information to truly guide and govern the resources and education that we give to them. And what we see typically is folks are just sort of managed by their PCP and slapped with whatever SSRI is most commonly prescribed. And it's ineffective, and they're still struggling, and they've never been told about EMDR, and they've, not seen an actual psychiatrist that has the depth of knowledge of all the psychoactive options. And that's I think what we're seeing most. There's a lot of trauma. There's a lot of loss. And so people that focus in trauma therapy, grief, and post-traumatic recovery are oftentimes the most helpful to this demographic.
Yeah. I've in my own world, I've seen EMDR as an example with trauma and PTSD be incredibly helpful. And you're right. A lot of people don't even know what to look for or how to look for it, or even in your case, how it affects the family, right? Mm. How it affects your spouse, or if you have children, how it affects them.
And it's until it's too late.
Right.
And the only difference between that social system collapsing and it staying erect is education. And I mean, my husband didn't know about the stages of grieving. Why is she angry? This must be a character trait. When in fact, it's just like me processing my trauma. And so we try to help the person understand what's going on and why it's happening, and take some of the shame away, so that they're more inclined and enthusiastic to get assistance, because a lot of folks just will not receive it. We're seeing that a lot of folks don't actively pursue it because it makes them feel more shameful to admit that they need the help. And that's a lot of what we focus on, is just finding the tremendous strength and vulnerability and allowing yourself to be helped, and recognizing that it's not weakness, and it's not all these things that there's such a stigma around, because that's still the opinion of a lot of folks coming through.
And you said you've worked with hundreds. How do people find Less Leg, More Heart? And are you national? Is it something where you can really only operate locally? Tell us more about the actual organization.
Yeah, so we've served amputees. We just did our metrics in 32 states. We operate all remotely because of the way that our rollout sort of process is. So we customize everything that we give to folks. And so when people find us either through largely word of mouth or social media or YouTube or our website, or, we have around where I live, there's some I've lived here for a long time. And so, there's a good word of mouth, and the chambers are involved and Rotaries. But on a national scale, some of the speaking endeavors that I've done and the friends and colleagues that I have around the country just filter folks our way. And so we have not directly opened at 5 years even, like direct referrals from hospitals or acute rehabs. We still haven't even gone into those places to hand our brochures out, because we already are managing a high workflow. Already this year, somewhere in the realm of like 35, 36 amputees, and we've got like 6 to 8 folks in our pipeline. And we get these waves that, there could be 8 people in a week, and then maybe there's not for a couple weeks, or sometimes they trickle in at 2 a week. It's still so post-pandemically oscillating in terms of volume that we want to make sure that is managed well and with excellence. So we're national. We tend to do a lot of like local community projects in terms of accessibility for people's homes in places that some of our volunteers or we live, because it's nice to have an on-site representative, or we make a new volunteer in a place where someone needs help that we don't necessarily have a volunteer. So we've got about 3.5 dozen volunteers from around the country. And we send care packages to every amputee that submits their information through our website. There's a contact form, and one is Amputees in Need. They send their information, and then we chat with them for an hour. We get all of their intake, like we talked about, medical, psychological, social, economic circumstances, and then we allocate them an award within 3 to 5 days. So they get something: education, mentorship, advocacy, funding. And then we actually check in with them at 1, 3, 6, and 12 months the first year, and every 6 months after that, for as long as they want to remain part of the program. So that system has proven to be really helpful, because those that do engage in the frequency that we've set it up have a lot better outcomes than the folks that just want a quick handout. We're trying to do something long-standing, and we want to promote independence and autonomy and power and confidence in people. And that skill is not a skill that they can acquire in a 30-minute Zoom with me or anybody on my team.
Yeah. And I bet that frequency and that cadence also breeds more volunteers and mentors as they kind of come through the program themselves.
Yeah, that's the ultimate goal, right? Rise by lifting others, whether it's with our organization or with any other philanthropic endeavor. We always encourage folks to just get involved with something that, sets their soul on fire, because finding purpose and meaning is a vital part, in my mind, of any kind of recovery. And putting yourself in a community of like individuals, whether that's like physically amputees or like in terms of your passion, the thing that you're supporting. So yeah, we love it when our beneficiaries come over to volunteer, and we've got a pretty good turnover, because we like to be a little family. So you had mentioned the weekly or the monthly support group meetings. That's really it's less of like a meet and greet and talk and support group in the traditional way where you make friends, although people do, connect with each other after the fact. It's largely taken the form of an educational format. So we have, health and wellness experts that will come on, or I'll run a session on something that's, amputee specific for the month. Like in September, we're running one on phantom pain, which is something that's been largely requested and is a pretty multifaceted topic. And there's a lot of options. And so we always encourage folks, whether they're part of our program or not part of our program, to jump into Heart to Heart. And we hope that they'll come to our program, because there's always things we can find to help people, no matter how far along in their journey they are. But if they want to just pop into the monthly meetings, the ones that resonate with them, that's always an option too.
I think that's great. I should direct people on how they can, register for those and be part of them. You have a couple interesting things, and I'll post the direct links in the show notes, and depending on where you're listening to this, in the description, if it's on YouTube or wherever. But just audibly, if you're listening to this in your car, if you want to register for those virtual heart-to-heart meetings, and you go to lesslegmoreheart.com, it's under the About section in the menu. So if you click on About or hover over it, you'll see the heart to heart there. You can register and be part of it. You also have a wonderful gala that kind of a red carpet gala that's under events. I recommend people, that's in December usually, but people kind of, look forward to that. It's a great way to contribute and support, as well as, something fun to do as well on a night out.
Yeah, it's going to be beautiful. We waited 5 years to really have the event that in the middle of the holidays intentionally, uplifts people and gives them that perspective. And, there's so much stress to be had, or stress that's made in folks psychologically during the holidays. I have to do this, and I have to do that, and I have to. And people forget sometimes in that pace to recognize that they get to, and that by just changing that word, it really makes the process of being busy and having to-dos enjoyable. And so I'm hoping that, in addition to being a significant fundraiser for our organization, that we can provide that perspective that helps the holiday season be a little bit more fun for folks.
Tina Hurley, thank you so much for sharing your story and the amazing work that you're doing with everybody. I wish you the best of luck, and come see us again sometime.
Thanks so much for having me, and I look forward to folks reaching out that may be listening.